Good afternoon, everybody. I'm just making sure that I've got all the various bits working. If anybody is watching live, actually all you live viewers, yes, please do. If you can just indicate you can hear me and you can see something on the screen. Okay, that seems okay. So I'm just going to wait just a minute and we will get started. I've got the Q&A set live, but I'll activate that later. So we will get started now. We've got a lot of ground to cover, so I just want to make sure that we have enough time. So good afternoon, everybody. My name is Nishant. I'm the curator of Smooth and Simple. And welcome to this Acne Scar Removal webinar. I just wanted to give you a bit of a kind of quick history of what this webinar's, well, you can see what it's about, just a bit of a history about how we came about, or why we're quite good at treating acne scars. We get a lot of people who come to us who are at the end of their tether now because they've had the years and years of battling acne. And I've got 12 years of in-clinic experience, and I've spoken to a lot of people who they've had acne since a very young age. They had it for 4, 5, 6 years, but they knew that it was always going to go. The problem afterwards is that you're left with this scarring, and the scarring is kind of permanent. You don't have any end in sight to that, so they feel worse about the acne scarring than they did about the acne in the first place, and it stops people from doing what they want to do, which is going on holidays, getting out and about. The summer should be a time to kind of get out and enjoy yourself, and people don't like doing that because winter offers a bit of protection. You can put scarves on, you can put hats on, and you can hide the scarring away. Summer doesn't allow that protection. So we get people who reach us and they've spent a lot of money on the acne treatments themselves, and suddenly the prospect of something else additional as a cost becomes almost a bit too much. So we understand that. We understand where people who've got acne scars are at in their lives. We also understand that some people are just starting off with them. They haven't realized that that's potentially the journey that's ahead. So our job is to get you to the end point. I personally have been doing over 5 years of actual focused study on acne because I saw a lot of people who really were troubled by A, having the acne, and B, having the scarring. So I really wanted to understand what was going on and understand the enemy, really, see what was going on, see how we could improve it. And I think that deep knowledge is what you need in order to be able to treat your acne scars. There are a couple of takeaways really from today. Right at the start, I'm going to say that we can improve all acne scars. There are no ifs or buts in that. You will never leave treatment after having picked up this knowledge without an improvement in your acne scars. So how are we going to get to that point? Well, the first thing is to understand why you get scars from acne. So we'll cover that. We're also going to talk about the types of scars you can get, and I'm going to show you some examples of scarring. We'll talk about the general treatment types that you can have when you're treating yourself for scarring. And what I'm also going to do is I'm going to talk about which treatments are going to be suitable for you, but when you should look to have those treatments, because that's quite an important part of treating yourself, knowing when to have that treatment, so when it's right for you. And finally, what we're going to do is we're going to talk a little bit about, or what I'm going to do rather, is talk a little bit about the smooth and simple approach and what we did. It's going to be two minutes maximum, and it hopefully will kind of make you understand or help you understand that we've understood the main problem with acne scarring and why the treatment plans are good for you. Because it's really easy to understand the treatments. You can read about all of them. There's a lot of marketing babble out there about every single treatment. You can also understand when you should have those treatments, but actually it's finding somebody who understands what your journey is all about and how they're going to use those treatments in the right way to get you to the end point. So that's the kind of thing that we're going to talk about today. Now, what I will do is I'll move on straight away, and we're going to talk about why you get scars from acne. So to get to this point, you kind of need to understand the journey of acne, really. And there'll be some people who are watching this as a bit of a preventative measure, really. They have acne at the moment, and they want to make sure they don't get scars in the future. Equally, there'll be some people who are just at the very, very start of breakouts, and they don't know if it is acne. And then there's some people who have had acne scars for many years, and we see a broad spectrum of people come in. It's a really, really popular treatment, acne scar removal at the moment. It's a really good time of year to have it done as well, because the sun's just starting to kind of fade away, and you give yourself a good 6-7 months of treatment time. So, quick recap on what causes acne. So, what causes acne and any spot really is that you have some bacteria. It gets into your pores and where the hair follicles are. And if those pores get blocked by sort of dead skin or makeup on top, what happens is those bacteria, they thrive on conditions where there's no oxygen. So they start feeding on the oil that you're producing in your skin. And the oil producing glands are right near your hair follicles. So what happens is if you happen to have the acne bacteria on your skin, those acne bacteria multiply rapidly in those situations and they cause you a big spot. Now, human reaction there is to do something about the spot. You can pop the spot. People use exfoliation to try and clear that out. And what happens is that acne bacteria that's rapidly multiplied now spreads, and it goes from one spot into a breakout very, very quickly. But the reason that the acne bacteria really multiplies, that you produce, when you get a testosterone spike, you produce more oil. And the more oil you produce, the more bacteria gets around. So the real key uh, for acne is controlling those testosterone spikes. So you control the amount of oil that you're producing in your skin, but you control that naturally. You need an amount of oil in your skin to keep it soft and supple. So that's basically what causes acne. And the reason you get scarring from that is, number one, that you get scarring around the hair follicles. There's been damage caused there by this acne bacteria growing. So you get damage, you get scarring there, you get knotty, hard scar tissue. You also sometimes, when you do pop the spot, you then get a bit of a dip or a divot where there used to be tissue and now there isn't, because you've done something with the spot. So you're damned if you do and you're damned if you don't. You also get excessive dryness. Now, with excessive dryness, what happens is, I mentioned your skin needs a certain amount of oil to replenish and heal itself. With excessive dryness, you basically don't get enough healing to the surface of your skin, so you don't heal effectively. Thirdly, pardon me, you've got antibiotics. Antibiotics are bad for your skin because they do actually stop the repair mechanism going on within your skin, and that's how they kind of work. They stop things getting into the normal action of your skin to repair itself. And it will be a top tip to take away actually from this. If anybody is actually on acne medication at the moment, we would strongly advise that you stop that and go and see either a dermatologist or somebody who's been dealing with acne for a number of years, because there is a growing body of evidence that these antibiotics are actually really, really bad for your skin. And we see people who've come and they're in their 50s and they've got acne scarring. And in a time gone by, it was a really easy thing for a doctor to prescribe antibiotics. It was an easy option. They work, but they absolutely destroy your skin. They thin it out, they stop it healing itself, and you're left then with the problem of the acne scarring. And most people that we see in later years with acne scarring have always had antibiotics when they were younger. You've also got harsh washes and acidic products. They keep your skin in a constant healing mode. You should have acidic skincare. That's a good tenet of acne management. You should always be using acidic products, but it's the overuse of those, and it just dries the skin out, and it does keep you in that constant healing mode. So you never really quite fully repair your skin. And ultimately, scarring is impaired healing. It doesn't matter whether you have non-surgical treatments, whether you have surgery. Scarring is caused because your skin hasn't healed properly. So we try and put the conditions in place to make your skin heal better. And that's what these treatments that we're going to talk about, that's what the treatments are all about. But before we get to that, I just want to talk to you a little bit about the types of scars that you may have at the moment. So the most common type of scar is a pitted scar or an ice pick scar. This is usually from picking spots. You cannot help it. It's just a human nature to do it. When I was younger, I suffered from chicken pox, and I knew very well that I shouldn't pick them because I'll get scars. And that's exactly what happened. Chicken pox scars are a little bit wider, so some people do get that, particularly in the temples. You get that kind of almost like a divot's been taken out of your skin, and usually it's because you get the bigger spots there, and it's been picked near the hairline. You get a bit more oil production. So that's pitted, sort of ice pick scars. You've also got raised scars, and they're from when you don't pick the spots. So I remember I said you're damned if you do and you're damned if you don't. The damage that's been caused under the surface of your skin near the follicle causes a raised overproduction of skin cells and a raised scar. You also get red scars. Red scars are generally when they're new. So that can be raised, it can be flat, but you just notice that it's red. And then you get pigmented dark and pigmented light spots. So pigmented light spots are from either overuse of an acidic product or a too stronger acidic product for your skin type, or it's using, so I think I mentioned that it was the overuse of the acidic skin product. And if it's a darker skin type, then you get these lighter patches where the pigment's kind of washed out a little bit. You also get pigmented dark spots, and that's when you've been using acidic products and it's the summer and you've not used adequate UV protection. So a top tip over here is if you're having any kind of treatment done, you should always use SPF. The number isn't as important as the fact that it should be broad spectrum, so you get full UV coverage. 30 is advisable generally, but if you're going away on summer holidays, don't stop doing that. Or if you're getting out in the sun, going to the park, please do that. That's your normal life. You should be doing that. You shouldn't be hiding away from it. But use a 50 broad spectrum, and that will mean that you don't get these pigmented dark spots. And then finally, you get scars from treatments. If you rush into a treatment thinking it's all singing and dancing, and we've all fallen victim to that, and it's very easy to do so, you kind of, you don't really want to be left with scars from those treatments. So sometimes you do get those. When they're acne scars, they look natural, while they're not ideal. And I totally understand that acne scars really, really knock your confidence. My chickenpox scars did for me for years and years and years. But they're natural looking scars. People will immediately associate them with acne. If you have a treatment scar, suddenly that opens up a whole new range of questions. What's happened? And you yourself will start feeling guilty about doing something a bit too soon. So you can get those. And what I'm going to show you is just some pictures of some examples of scars. So the very first one we've got, very common types of scars here. So this guy over here has got pitted scars, which are just these little ones here. He's also got the kind of the divot type scars, near his temples, and he's also got redness in the scars. So he's got a whole range of issues there, but very familiar sort of site. Now this is kind of scarring that would actually classify as moderate. I know it would feel and look very severe if you've got this, but it would classify with us as a moderate scar. And I'll get to the kind of why we classify them as moderate scars later. This guy over here has raised scars. So you can see these ones, they're raised and they're red. Quite fresh. You can see he's still got some active acne just over here. You can actually still have treatments done while you've got active acne, depending on the treatment that you're having done. Because some of the ones that I'm going to talk about later are actually good acne management treatments. So you kind of get a bit of a double-edged or a double whammy effect, really. Then we've got these two guys over here, or this lady rather. This is quite a common area for people to get acne scars, just on the tops of the cheeks. Very visible area. You can see that they're quite heavily pitted. They're slightly dark in pigmentation, so a bit of sun damage there. And just some ice pick scars here as well. But these are ones when they've been long established. And then this gentleman over here, for guys in particular, for some reason, this area is a really common area for them to get acne scars. And these are a common type of acne scars. You've got a mixture of pitted acne scars and the kind of divot acne scars. No color in these. They're not red at all. They're just normal skin color. but they cause all sorts of weird and wonderful shadows that you can't avoid, and there's no amount of makeup is going to cover these up either. So they're the kind of scars that you can get. So moving on to the treatment types, there are all sorts of different names for treatments. There are all sorts of different styles of treatments that you can have, but essentially they fall into these main 6 categories. The first one there is microdermabrasion. And microdermabrasion is a good all-rounder. It works by exfoliating very evenly exfoliating the dead skin cells on the top layers of your skin. And that's really, really good because it triggers your skin into going into healing mode, because it wants those dead skin cells there to protect from UV damage. And once they're not there, it goes, right, I need to heal myself. So, the cornerstone of any good acne scar removal program is a microdermabrasion treatment. You've then got mild peels. These are lunchtime peels. They're designed to not interrupt your life, to not give you any downtime, to not make you take any time off work. They're really, really good because they work like microdermabrasion and exfoliating those top layers of skin, but they also trigger off massive amounts of new skin cell production, which is what your skin needs to repair itself. And you will understand as we're going through all of this that, I hope you'll understand that we're all trying to just stimulate a natural response and a natural repair mechanism in your skin. Your skin has a tremendous capacity to heal itself. We just need to target it and just need to trigger it in the right areas. And that's what gives you lasting results. We've then got intense pulse light. Intense pulse light is targeted to dark pigmentation and red spots. So you can have this treatment done really early on, and it's designed to get rid of that redness and the pigmentation. And it's great because it doesn't then damage the other structures of your skin. So that's a really, really good treatment. It's called IPL, which you can probably understand is intense pulse light shortened. Then you've got Dermaroller. Dermaroller is one of our big hitter treatments. Really helps with raised scars because it flattens them out. It also helps with pitted and divot scars because what it does, it stimulates collagen production, and it's brilliant at doing that. And so what you're essentially doing is you're flattening from the top and you're filling out from underneath, and that's where you get those permanent results. It's not a 2, 3, 4 month masking. It's a permanent result because we stimulated the collagen in that area. And the Dermaroller is a really, really serious treatment, and we don't do that without any kind of skin conditioning. Some people have done that. And when I mentioned those scars that you get from treatments, Dermaroller is the most common one, and usually they're kind of in a line, so you know that you've had a treatment done. So if you're looking at considering a Dermaroller treatment and that's your first port of call, just proceed with caution and make sure that your skin's prepped, either with one of the microdermabrasion or mild peel treatments, or if you've been using some good skincare, and this is medicated skincare designed to resurface your skin, you could probably then jump straight into Dermaroller. TCA peels, so they're unlike the mild peels. The TCA peels do give you quite a lot of aggressive peeling. You do need a couple of days off work. You are going to be quite pink and a little bit red raw afterwards. So usually, a few days off work. It doesn't hurt, but you do have to really manage it. So you do have to keep out the sun. You do have to make sure you use SPF because it can cause, if you don't do that, you can get darker pigmented spots in those areas. And you're kind of resetting the clock, or you're trying to chase your tail all the time with those treatments. And the final one is laser resurfacing. And laser resurfacing is the harshest treatment that you can do. It costs a lot of money consequently. You do need time off work, sometimes a week, maybe 2, depending on how severe the resurfacing is. Effective, but you still may need to have some of the other treatments alongside, just to either condition or to get you to the point where after you've had your treatment, just to kind of iron out any minor issues. But very effective treatment at doing it, and not to be taken lightly, just because of 2 things: it's cost and the severity of that treatment. So it's the time cost as well and the recovery period. You'll be advised when you're having laser resurfacing to buy skincare to use during and after. If you're advised that, please do take that advice, because it's not a gimmick. They're not trying to get more out of you. It's designed there to protect your skin. And you've gone through so much already with your acne. You want to do everything you can to protect your skin at that point. So, they're the kind of treatment types. And understanding those is really, really important. But what I'm actually going to talk about now is when you should have those treatments, because it's quite good to, you'll read all the marketing spiel everywhere. You'll see that clinics talk about this all-in-one wonderful treatment for acne scarring. There is no such thing. Scars are living, breathing things. They evolve, they change. What you want to do is make sure that your treatments evolve with that. So, don't fall for the marketing gimmick. We did the same thing. We've been treating people with acne for 12 years, 13 years almost. And, we'd get a new machine in. And the problem we've got then is that you've got this machine that, we're a business, you paid out money for and you want the return on. But if it's not in the interests of the patient, if the person sat in front of you is not going to improve as a result of having those treatments, then you really need to consider whether that's the right thing to do. So the important thing is you will face this marketing talk all the time. Like I say, we used to do it, but we learned our lesson from that and we changed our approach about 2 years ago into a more planned approach and a structured approach. And the reason is because of the timing of when you should have your treatment. So we'll start off with microdermabrasion. Like I said, it's a really, really good starter treatment. You can have that any time. It does resurface your skin very slightly, and it does immediately improve the feel and the softness of your skin, which is really important. You should leave from every treatment thinking something's happened and I'm happy about this treatment. And microdermabrasion is really good for that. You've also got mild peels, those kind of lunchtime peels. They're great because they really promote new skin cell growth, which you need. You need that healing mechanism. And they also soften the skin. So again, those two treatments you can have at any time. The intense pulse light for removing redness, for also removing pigmentation. Again, you can have that at any single time. There's no prep needed for having those intense, those IPL treatments, mild peels or microdermabrasion. They're good prepping treatments. And the removing the redness is an active treatment. You've then got Dermaroller. Dermaroller is great at removing pitted scars. And this is the one, if you're thinking of going into a Dermaroller course straight away, please bear in mind your skin needs to be soft and it needs to be supple, and it needs to be in healing mode. You can do more damage with doing a Dermaroller too early than it will do good. So I wouldn't discourage anybody from doing that, but if you're in a position where you know your skin is soft and supple and you'll be able to tell yourself, can you pinch it? Does it feel hard? If you can't pinch it and it does feel hard, you want to avoid Dermaroller straight away. You want to do some kind of skin prep. And skin prep can be one of these two treatments at the start, microdermabrasion or peels. But it doesn't have to be. It can be the fact that you've been looking after your skin very well and you've got the scarring, but it is soft and supple and you're using some medicated skincare, and that prolonged use will help with the Dermaroller and you'll get better results quicker. You've then got TCA Peels. TCA Peels can actually, again, they can be done without any prep. The key with the TCA peel is if you're doing that and jumping straight into a course of that and not taking on some of the skin prepping, is to build up the strength. It's not about jumping into a very, very acidic peel straight away because that's going to give you quicker results. That's not. You need to still get your skin to feel into it, because if you go too quick, too soon, you're going to cause it more damage. And it kind of almost goes, I can't handle this intense treatment. So always go for a course and always make sure that you build up the strength. You shouldn't be going into something straight away. So Dermaroller will need some skin prep. TCA Peel doesn't need skin prep necessarily, but build up the strength slowly and have a course. Laser resurfacing doesn't need any prep before, apart from the clinic that you will use, the laser clinic that you will use will advise you to use some skincare, and that is really important to use. Please don't fall into the trap of thinking that they're trying to just get another sale out of you. They're really not. Their interest is in making sure that you get a good result, because if something goes wrong with the lasers and you haven't done your skin prep, the damage is very hard to reverse. So please do listen to them. Take on all of that skincare. We don't do laser resurfacing. We find it too harsh for people's skin, and we can treat it better with these 5 treatments up above. But if you do see somebody, please do heed their advice. So they're the kind of treatments that you can have and the options. Generally speaking, most treatments will fall into one of these ranges. I'm going to very quickly talk about treatment plans, and hopefully one of the big takeaways you've had from today is that You can't just use one treatment to solve everything. One treatment will be good at the start, but it has to change. So we put together these plans, and we put them together about 2 years ago. And it was from, I would say, 10 years plus, 12, 13 years of probably doing it wrong and getting people on a course of a single treatment, and then saying, oh, well, now we've got to move you on to a course of another treatment. And each time you're shelling out and you're not happy with whether it's the right advice or not. So we put together these plans, and you get 2 treatments a month. No negotiation, always 2 treatments a month. And we adapt those treatments according to your improving scars. So it means that sometimes a microdermabrasion might be good, but sometimes the next treatment, maybe the peel is a little bit better, or you might need to start with the IPL and then move on to a peel after that. It also enables us to treat one area with a microdermabrasion, in your same visit, one area with microdermabrasion, the other area with a peel, or one area with IPL, one area with microdermabrasion. So it mixes and matches as your scars change and improve. And that's been really beneficial to people because you get there quicker because you're only treating the scar with what it needs to be treated with. So we've got 3 plans, and we made it so it was easy to understand for everybody. We've got mild, which is for really early onset scars. You've just got rid of your acne, you're happy, this is great, but I've got some scars. Usually you've got a little bit of skin toughness and a bit of uneven skin tone, and typically you've got some red scars. That's how you know if you're in mild territory. Most people actually fit into this moderate territory, and that's for established scars. There's no age limit on this, and there's no time limit. People come to us 20, 30 years after they've had their acne scars. People come to us really, really early. People come to us after 5, 6 years. But typically the characteristics are that you've got pitted scars, or those divots, and you've also got very tough skin. Like I say, most people, I'd say 90% of people fit into moderate scarring. And then you've got severe, and there's for really deep acne scars, very hard skin, very patchy, blotchy areas. We've only ever seen or treated 3 people on a severe scarring plan. That's for a reason, really, because most people, it will feel like severe scarring, and I understand for each individual, whatever scarring they've got feels really, really bad. But we have to be really objective about this, and severe scarring is quite rare. So we always try and keep you at a plan where we know it's going to be easy on your pocket, but also easy on your skin, because your skin has taken a battering while you've been treating your acne. We want to make sure that it's got a chance to recover and heal itself. So we keep you on the lowest active, effective plan. And if we feel it's not working, we can move you up or down. That's in discussion with you. We had a guy who had the severe acne treatment. He had, I would probably call moderate to severe acne scars. Started him off on moderate for a couple of months, just got his skin prepped, and then just moved him up to severe for a couple of months because he wasn't really responding to those treatments, and he got a good result after those 2 months. So we can play around with that a little bit. So that's the treatment plans, and a planned approach, a mix and match approach, is the only one that's ever going to work for your acne because it's going to improve, and you can't do severe treatments with improving scars because there's no point. So we're kind of getting to the end now, and I'm going to quickly talk about the main things that you should hopefully have taken away from today. Acne scarring will always be there. Unfortunately, there's no magic wand, there's no magic secret formula. We can't get rid of acne scarring. Our aim is to always get you to 18, 90% improvement, so you feel confident going out again, and you feel confident walking around without makeup. You feel confident looking in the mirror, but there will always be something there. If you really scrutinize it tightly, you will always notice something. Treatment should be mild. Your skin has taken a lot of abuse already. It's taken a lot on to heal itself. You should always be treating it gently and mildly. So we try and do the least intervention to try and get your scar removal, your acne scars removed. And you can have soft skin. We can get rid of those or improve the appearance of those scars, and it'll last a lifetime. These treatments aren't a 3 months of effect and then you have to start again. They aren't like that at all. We always, as a company, as a bunch of people, we always make sure that we advise you on ongoing skincare and making sure that your skin stays smooth for a lifetime, and we'll keep doing that because that's our mission. That's what we want to do with this, because I've seen the people who've come in, and our guests and patients have really been down in the dumps about their skin, and we can improve it. There's not an acne scar that we can't improve. So if you'd like some more information, please do head to our website, smoothandsimple.co.uk. or can call us on 0161 711 0022. My name's Nishant. Please ask for me directly. I'm in every day that we're open, and I'm happy to help out. So I'd like to just open it up to some Q&A. Thank you for watching today. Hopefully you've taken some really, really good information away. And I'm opening it up to some Q&A. So if you get a chance, please do just tap away, and I can try and answer them. Okay. So yeah, just one quick question here is, can you treat scars while I've got some active acne? We can do that. A lot of the acne scarring treatments are actually what you would treat acne with as well. So it will not only prevent scars that way with the ones that are active, but it will also improve the scars. So yeah, you can have that at the same time. You don't have to be waiting to have those treatments done. Okay, will scars disappear completely? Unfortunately, they don't disappear completely, but you can expect an 80 to 90% improvement in those scars, which for most people is excellent, particularly knowing that this is a lifelong thing that they're going to have. Yeah, can I prevent scars? That's always a good one. Yeah, you can. You can't prevent them from forming entirely. You can only minimize that, and you can minimize that by good active acne management. We can advise on that as well. A couple of main things to take away would be that you don't pick spots. I know that's really, really difficult, but you don't pick them because you're causing more damage. If you're going to do that, you want to do that with exfoliation so that it opens the pores up and allows the the active pustule to then dry out and disappear, and that minimizes the scarring. And then somebody just said, can you treat all scars? Yeah, we can. There's not a scar that we can't treat from acne. So yeah, please do contact us or contact anybody, a good dermatologist, a good acne clinic. They may try and get you on a single course or something. Please, take their advice. Please do listen. We found through trial and error, through people being happy, unhappy, that we have to mix and match the treatments that they're having. And we now don't get anybody who leaves here thinking that we haven't improved their scars. It just doesn't happen. And that's a great place for us to be because we're very confident in our treatments, but also great confidence for you to take into it. And you will see improvements from the very first treatment that you have. So that's it from me. I don't think there are any more questions coming up. Enjoy the rest of your day. And thank you for watching.